the British Medical Association has warned that the NHS is on the brink of collapse. No, it is not the same headline that I read last year. It's not the same headline that we all read every single winter. But a poll revealed that more than 2 in 5 of the most senior hospital medics are planning to leave the NHS in the next year. The BMA is now calling for immediate government action after the survey suggests that roughly 8,000 consultants suggested pay and pension tax arrangements were some of the reasons why they plan to leave. Meanwhile, 9 in 10 consultants said this year's pay rise of 4.5% was inadequate or completely unacceptable. Are we at crisis point in the NHS, or do this lot need to shut up and get to work saving lives? Joining me on the show right now is Helen O'Connor, who's a former nurse and a GMB union spokesperson, and former Health Secretary Stephen Dorrell. Thank you very much, both of you, for joining me. Helen, I will start with you. Is it not irresponsible towards patients, people who some of these medical professionals took the Hippocratic Oath to protect, if they now decide that they want to quit their jobs en masse?
Well, the BMA are absolutely correct. The NHS is in a state of collapse, and that's from years of restructuring, years of NHS trusts having to find cost efficiency savings, and years of attacks on the pay terms and conditions of doctors and nurses. And we have to be really clear, there is no NHS without skilled, experienced staff to provide the services to the patients. So things are in a pretty dire state. And what are nurses and doctors supposed to do? Are they supposed to carry on with everything collapsing around them? The fact is that things are in a really bad way now. The workloads are really high. It's the most experienced staff who are leaving the NHS, and that is a risk to patients. We have to be really clear about that. Pay terms and conditions are inextricably linked to patient care and patient safety. And if you have a health service where there's inexperienced staff who don't know what they're doing, that's a risk to patients. That's where patients will suffer harm. If there's not enough staff, they'll suffer neglect. So we have to be really, really clear here. We need a situation where the staff who deliver the service on the front line are paid and looked after properly, because good care will flow directly from that. OK, so former Health Secretary Stephen Dorrell, apparently good care is directly linked to how much people are being paid.
No, it's not, in fairness, what Helen said. She said good care is related to it having a properly motivated and engaged workforce, which is clearly true. I think, if I may say so, there's quite a lot of grandstanding on all sides going on here. We shouldn't be surprised the BMA represents doctors. That's what they're paid to do. We shouldn't be surprised when the Royal College of Nursing represents nurses. That's what they're paid to do. What is undoubtedly true is that there is a shortage of skilled people to work, both in the health and social care system. The two are part and parcel of the same problem. And where I think we need to calm down a bit is to recognise that we will never deliver our objectives for either health or social care if we don't address the concerns of the people who work in those services.
OK, so Helen, I'll throw it back over to you. Is it a bit too easy for medical professionals to blame a lack of pay and government inadequacies? Because from where I'm sitting, I get emails every single day about this. Patients, potentially millions of patients, are very unhappy with what they would regard as a poor quality of care, and the negligence payouts from the NHS would appear to reinforce that as well. And that simply cannot all be. Please do not give me the usual line of "we're all so tired that we can't do a good job."
So you've got to think, look back. Yes, you've got to look back to how the situation has developed. And when I first started in the NHS, we did have good staffing. We did have safe services. People could get appointments with their GP. And then you're looking at years down the line, the impact, like I said, of constant and continuous restructuring to the front line, pay terms and conditions being driven down. And it's actually very, very difficult when you work in the NHS.
Sorry, just quickly on that one. It's just difficult for me to understand, because when you first started out, when you said there was adequate staffing and everything was rosy in the garden, the budget for the NHS was a lot less than it is now. So what is it? Overpopulation?
No, what's happened over time is that services have been hollowed out. Services have been hollowed out. So there's been restructuring. Services have been moved, merged. We've lost something like half of the beds across the NHS over the last 30 years from cutbacks. And in the meantime, you've seen the conditions of staff not keeping, the pay of staff not keeping line with inflation. So things have been cut down. Things have been pared down to the bone. And right now we're in a position where a lot of staff are leaving, as the BMA have pointed out, and these are the most experienced doctors. Last year you had 40,000 skilled, experienced nurses leave the NHS as well. So you've got to think about the staff who are in the NHS now coping with all those vacancies, coping with stress, people going off with stress. So this situation has developed over a period of time. That's what I'm trying to say to you. And things were better before. I do remember when things were better before. You could get a face-to-face appointment with your GP, for example. Nowadays, you'll have people not even able to do that, or having to.
Okay, I'm just gonna look back over Stephen, former Health Secretary Stephen Dorrell. Where are all these people going? Are they going to go? Are they going to work in somebody else's healthcare service? Do you know?
Well, first of all, can I say that there's a tendency in the health service. I've been around the health service. I was first appointed a health minister in 1990, now over 30 years ago. And I was always told then that things used to be much better. I used to be told, actually, by a journalist friend of mine, that the health service was established on the 4th of July 1948, and on the 5th of July 1948, morale reached an all-time low. So this is a story that recurs. But having said all that, there's a serious issue here. Health and care delivery, social care, including as well as the health service. I cannot overemphasize the importance of thinking of the two together, does rely on skilled, motivated, professional people. Slagging them off from public podiums doesn't help the issue. What we need to do is to address the issues that stand in the way of motivating them. It's undoubtedly true people are leaving the service. That is a problem for the management of the service as well as for the individuals. And we need to engage with them and with their representatives to address a real problem, but try to do it in a way, as I say, that avoids grandstanding and addresses the issues one by one.
Stephen, thank you very much. I hope you don't feel undervalued here, Stephen. I know I gave the first word to Helen, but I'm just going to give the last one as well, because we are a bit pressed for time. But, Helen, what other country's health service are all these medical professionals leaving to go and work in then?
So people are leaving. I mean, they're leaving for other jobs. I, for example, left in the end. And one of the reasons I left is because it was very demoralising for me as a nurse to not be able to get patients. But what
other country's health service are they leaving to? Because otherwise they just want to leave the profession, don't they? They don't just want to leave our health service.
So they're leaving. My understanding is they're leaving completely.
You can, Stephen. Go on, Helen. You answer, and then I'll give the last word to Stephen then. Go on.
So it's not necessarily that they're going off to work. And I mean, some are going to agencies because the agency pay and conditions are better, which is very, very expensive for the NHS, actually. And we'd be far better off retaining our staff within the service and paying them properly rather than using agencies. So that's one example. And then some are leaving the profession completely. I mean, myself, I'm a typical example of that. So it's not necessarily the case that they're going to other countries. But I just want to make the point just really quickly. It's very demoralising when you're a healthcare professional and you cannot get services for patients, or patients are waiting a very long time for things, and that's driving people out as well.